Janowski of Sonata Laser Aesthetics. I want to talk to you today about an interesting development, a wonderful development in the world of fillers, and that's something called a microcannula. Microcannula injection of fillers has completely revolutionized the way we apply fillers, and it's going to benefit you, the patient, in several ways. Microcannulas are not needles. They are actually small needle-like projections that we use to apply filler that have a blunt tip. This blunt tip allows me, the injector, to apply the filler with virtually no bruising. If you can imagine, a needle passing through tissue will encounter blood vessels and it will cut through a blood vessel as soon as it comes in contact with it. If a cannula, on the other hand, will move that vessel out of the way and keep on going. So it's basically a non-bruising technique for fillers. And fillers are wonderful products, but we all don't like the bruising that can occur. This virtually eliminates that problem. The other nice thing about microcannulas is they hurt a lot less because they're not cutting through nerves or irritating nerves as they're going through the skin. And so the recovery is much more straightforward. It's very easy to undergo the process of a microcannula filler injection, and there's almost no bruising. We make a tiny hole at the injection site with a regular needle and thread the filler through that hole. Far fewer poke holes are also necessary, so there's a lot less needle poking with this process. So this is a microcannula here, and it is not sharp. I can touch that. If that were a needle, that would cut me. So this is a flexible cannula that looks like a needle but behaves in a completely different way. I'm willing to bet at this point that probably 99% of injectors are not using this technique. So ask your injector if they have the microcannula technique or have learned it. I've learned this technique, I'm applying it, and my patients are much, much happier and they're recovering much more easily. So next time you come in for your filler, we'll probably use this device here, the microcannula.